Howdy folks. Today we're going to be working with the vagus nerve. And this is really wonderful if you have any kind of anxiety or your nervous system just feels like it's really wound up and you'd like to settle it on down. This is really great for digestion and also elimination. This is nice for any breathing issues, respiration, if you have high blood pressure, even low blood pressure, because the vagus nerve regulates many of these things in the body. And the operative aspect of this sequence is squeezing and releasing the tissues around this area, okay? And some things that we'll need for our practice today, a bolster or a rolled up blanket or a pillow with a beach towel around it, something that's kind of elongated and rather firm, but has some give. Okay, I have a blanket here underneath my knees, which will also be sweet to my hips as we're going to start to rest on the side body here in a moment. I have a blanket and a block underneath. I have another block out here. Remember, stacks of books or even other pillows can work great for our purposes today. So I'm going to set this block out front. I'm going to put the blanket on top of it. And I'm going to be mirroring you. I would like to make sure that you start with your left side down. And in fact, we'll do that now. Knees are going to point towards your right. Your left side is going to come onto the side of whatever object you're using as your bolster. And bring your arm across, make a little bit of room, and then set your head down. Now for me, I'm going to turn my block up one more notch so that I have some more height. Be a comfortable place to rest your neck. Shouldn't feel like you're flopping. Get some alignment here, okay? And I'm looking to rest right on the edge of the rib cage. So not too forward, not too back, right on the side. And if you feel like your hip is sticking into the ground, you can put a pillow between your thighs. That can help. All right. This arm at this point is just going to rest right here. And I'm going to take a few inhales and exhales. And since we're wanting to squish and move the tissues, please breathe right down into where you feel the pressure of the bolster on the side of your rib cage.